When do you decide if a patient needs medications to go to sleep?
If the behavioral interventions that you've tried, some of the basic things we've been talking about are not working, then a short-term course of sleeping medicines can be helpful.
Short-term course?
Yes.
2 weeks, 1 week, 2 nights?
No more than 4, 2 weeks ideally, and it really depends on what's thrown the sleep off. If a patient comes in and says, boy, I've always been a great sleeper, lost my job, now I can't sleep. Perfect time for sleeping pills there. You think that stressor is going to come and go. They return to their normal, very excellent sleep habits. No need for sleeping pills anymore. The problem is when people end up on sleeping pills day after day, chronically, in other words, months to years, that becomes counterproductive.
Do people become addictive if they're used to taking it every night? I would think people, if they're used to taking sleeping pills at nighttime, even if they don't need it, they'd say, I think I better take it or I'm not going to sleep tonight and I want to be able to sleep.
And that's, I think, what I try to teach the patients that I see. I think the newer sleeping medicines, from a chemical standpoint, have less problems with addiction, but it's that behavioral routine, the act of taking something becomes just as important as the chemical, the pill that you're actually taking.
Are there different selections of different sleeping medicines, number one, to put somebody asleep, to keep them asleep, where they won't be groggy in the morning? Is there an ideal sleeping pill, or it depends on the patient's history?
It absolutely does, and the medicines that they're taking, what else they're taking in, if they're a consumer of alcohol or caffeine, nicotine, all of those factors come into play when you're trying to pick the right medicine.
Can you just remove those, though? You can remove alcohol at nighttime, you can remove cigarettes at nighttime?
And we do, and we can expect the sleep troubles to last after you do that for a period of months often. So part of it is just setting the patient up with some realistic expectations that those chemicals that they were taking also affect their sleep. And as they come off of those, or withdraw, if you will, some sleep changes are normal and expected to occur.
How about the people who wake up in the middle of the night and can't go back to sleep? How do you treat them?
Very common. You have to look out for things like depression, anxiety. It really depends on what's waking up, but I always try to get at that. What's waking you up? Often people don't know. They wake up, maybe get up, use the restroom, come back, and depending on the time of night, how long they've been asleep, they have variable success getting back to sleep.